Right, so your face is all expecting because we're going to talk about apps. I mean, it's not all about apps. I'm Martin Evans. I'm Head of Communications for South Staffordshire and Shropshire Healthcare Trust. I'm not a clinician and I feel academically inferior in this room, having listened to what you guys all do. But I'm ex-service, and this is quite relevant to what I'm going to talk about. So I'm a veteran, and actually being a non-clinician has probably helped with the development of this app. So I'm going to talk about the process to develop it. I'll talk about a bit of the efficacy and the credibility of it, and then I'll talk a bit about the politics behind it, because there's all these things, there's always politics, and how we sort of got around some of that, and also then the profile, which is probably the most important bit. So the apps itself, I'll start off with the Joining Forces app. And the reason why we developed the app is because our trust runs the MOD acute inpatient for the MOD, which is a network of 8 NHS institutions. So the development of this app was actually part of the value added to the contract. That's why we started off doing it. It's free, and it was designed for a specific audience, which is serving member of the armed forces. The whole sort of look around it was for that type of audience, serving member of the armed forces, and that could be TA. I'll talk you through the Air Force one because that's my service. So visually, that's what it's for, lots of pointy things. It's a hawk, which I can tell I've thrown up loads of times in. The whole idea behind it was actually a mental health awareness app. This wasn't a self-diagnosis, people will do all that sort of treatment and whatever. This wasn't about that, it was about mental health awareness. So that was one thing, signposting was the second, and reducing stigma. And if you think stigma in mental health in Civvy Street is bad, you want to go in the armed forces because it's about 20 years behind that. So it was quite an important sort of thing to get involved with. It was front-faced by in a connection, so it won't do the video. But it was front-faced by a consultant psychiatrist, Dr. Martin Deal, who's also a TA colonel. And we thought it was really important to front-face it with a clinician, and actually a clinician in the service eyes with credibility. So it's got this whole section, as you can see there. I won't go through because I guess we've probably got about 5 minutes, and everyone else has got about 15. Just go through.
It finishes at 8:30.
8:30. Fantastic. You've got 45 minutes to listen to it. Get on.
You've got plenty of time. It's just that Brilliant. I want to give people time to go down and network if they wish to.
Brilliant. 45 minutes. So it was based on 10 mental health disorders, came from the World Health Organization, with one added one, which is operational stress and battle mind. That's what the military wanted added in. And that's really about having an operational battle mind when you go out on operations, and the difficulty is then not switching it off, and you're aggressive and all the rest of it when you come back. So they wanted that added in. Big debate of whether it's mental health problems or mental health disorders, and how we phrased all that, as you would expect. So this is the meat of it, really. So if I just go into something like alcohol abuse, and it's the same for all of them, as he talks about what is it, the signs and symptoms, the advice, how to get help, and if you link to the internet, then further details, which might go through NICE guidelines or whatever it is about that particular disorder, which might be relevant to the officer, the commanding officer, whatever. So each one was, the idea was to try and keep it in very simple sort of language. And I can tell you, you clinicians and academics, you do not write for squaddies. So the important bit, which is what I said about being a non-clinician, was to get the clinicians to take those mental health disorder problems, write it up, and me to change it into really squaddy speak, and then to get it validated, if you like, back through the clinicians again. So that's the sort of thing that you can see what how it follows through. With advice for you, and with advice then for the families. The credibility behind it is endorsed by the Royal College of Psychiatrists. That's important. You've got to have some sort of proper credibility endorsement, and it was also endorsed by MOD. But the politics behind all of this was definitely in dealing with MOD. I'm ex-service, and I've dealt with MOD obviously through the Ministry of Defence and the hierarchy and such like, which is actually quite difficult because if you know the Ministry of Defence and you know the services, they're incredibly tribal, all fighting over each other. So to have Martin Deal to front face it took a lot of guts from him actually as a serving TA colonel of 30 years, because he took quite a bit of criticism from within the army itself, not from the other two services, but particularly within the army. So there was a bit of politics, what you're going to add to it. We don't want operational stress, you do want operational stress. We want some videos in of people who've suffered. That's fantastic. Give us the people then, because I can't go and find them. You've got to give us the people, and they didn't, because serving people in the armed forces will not talk about their mental health and illness. So that's a sort of bit about the politics behind it all. It was developed on Apple, and then we later developed it on Android. And if you've developed apps, all you clever people out there, Apple was because it's the biggest seller, obviously, but it had to be completely recoded to write it on Android. And obviously with Android, there's a number of different devices, so it's much harder to test. And Apple has a better sort of quality check, if you like. So that's the joining forces one. We launched it and we profiled it, which is actually quite important, because I guess the question you're going to ask, well, how do you prove that anyone's actually used it? We can't. You can't prove that actually someone's gone into the GP and said, I looked at this app and said I needed to come and see you, or I went to go and see their senior medical officer. You can't prove that. But how we profiled it and sort of got feedback was mostly through social media. We had this was launched through a national profile, which was huge, really important to us. It's had about 6,000 downloads, this particular app. And we had the Armed Forces Minister who launched it. We got sort of award nominated for The Guardian and stuff like that, which is great. It's a great cocktail party, but mainly it profiles in The Guardian. So that's where it was quite important, just to get that sort of national profile. And then to seek the social media feedback. So 2,000 likes on Just an Army Facebook, loads of positive comments. And actually, from an ex-serviceman, the comments did gobsmack us, actually, because I thought it was the cynical audience. Service people are very cynical, and I thought it was going to be a cynical reaction back, but it wasn't at all. Really positive, from comments like, about bloody time, why didn't you do this 3 years ago? About time someone's doing something for the armed forces, all that type of stuff. And is it just for officers because it's on Apple? No, it's not. So that's the sort of type of comment, and when are you doing something for veterans? So we took some of their feedback, which also included, why aren't you doing, it's a Big White Wall, it's an advert for Big White Wall as well, why aren't you doing something for veterans, and if you're going to do something for veterans, and add some stuff in about videos. Much easier to get videos of veterans to talk about their issues. And that's what makes the big difference with this app, is adding in 5 videos which are really moving, the sort of video veteran stories. We're not linked to the internet, so I can't show you, but that's the sort of menu when you're getting to it. 5 veterans from Afghanistan, from the Falklands, from Northern Ireland, from Iraq, so real moving sort of stuff. And the feedback has been genuinely moving to say, well, I realised actually watch that video, it's not just me. There's someone else who's had the same sort of issue. And the whole point of the videos, and you guys mentioned it, I think you mentioned it before, was messages of hope. It wasn't doom and gloom, and I'm not going to get past this, I've had this for 20 years and I've got to look forward to this for the next, till I die. So it was about messages of hope, really. The important bit as well is that the media-friendly bit about armed forces and veterans is PTSD. If you talk to Martin Deal, he'll say that it's the most overdiagnosed thing there is about mental health issues within the military. It's an acceptable face of, well, I've got an issue, I've beaten someone up, therefore I must have PTSD. And we were very clear with some of these videos. It's not just about that, it's about alcoholism, it's about depression. It isn't just about PTSD. It isn't just about the nasty stuff you've actually seen. If you've beaten someone up, you might be just a nasty person. And that's Martin Deal as the psychiatrist was absolutely clear. It's overdiagnosed with PTSD. So this wasn't just a focus on that. That's the media stuff that you hear a lot about. It's PTSD focused on all the time. So again, we launched this with social media. The difficult bit about this, and these guys heard me say, I'm passionate about this. I'm ex-service, so I'm passionate about veterans getting a better healthcare. MOD pay lip service to that, in my personal opinion. And in terms of trying to get them to push this and profile, which we've had this particular app out for about 2 months, not interested at all. It's all about, yeah, we're interested in veterans, but we're not going to actually do something, get off our arse and do something about it. I'm passionate about it and really disappointed that MOD talk a good game and politicians talk a good game, but don't put anything behind it. And that's the difficulty with this app. So the promotion of it has actually been done through us. I'm head of comms, so I have a media background and all that sort of stuff. So I can promote it through sort of as much as I can. But the contact with the national media, which is really where you do need to profile it, is through MOD and MOD PR. And as I say, the sad thing is they haven't really sort of pushed it as much as we'd like. So and the particular bit about that, we have 2 of the people who've done the videos are really happy to talk about their story. That's the profile story. That if them talking about what it's meant to them. So there you go. I don't know. That's it's sort of 11 minutes or so, but that's the sort of the process, the politics, a little bit about the politics and the profile behind it. It's not the same as the other stuff you were talking about. It's about mental health awareness and raising that sort of awareness and that anti-stigma. And it is difficult to prove, so like I said, who's used it and who's come to a GP because they've seen it. But we're pleased with it, we're proud of it, we just wanted to promote it a lot more.